Knee replacement surgery can improve the quality of life and mobility of patients suffering with severe knee arthritis. Arthritis is the inflammation of a joint, where the cushion between bones in a joint, the cartilage, can wear away over time, and this can cause the underlying bones to become exposed and to rub against each other. And when that happens, it can be very painful, and in the knee, this can eventually lead to difficulty walking, especially long distances or on uneven surfaces, going up or down stairs, or even finding a comfortable position during sleep. Early treatment of arthritis is important. It includes weight management, exercise, anti-inflammatory medications, and often injections. Emory is actively conducting research to find new treatments that may help not only reduce some of the symptoms of arthritis, but also potentially stop or slow the course of arthritis. Knee replacement surgery is typically reserved for those that have tried other non-surgical treatments and continue to have symptoms that affect their quality of life, and x-rays or other imaging that confirm that the knee joint is severely affected. Surgery may be a partial knee replacement where only one of the 3 compartments of the knee is resurfaced, or a total knee replacement where all 3 compartments of the knee are resurfaced. The main benefits of knee replacement are reliable reduction in pain and improvement in motion, which is often lost in an arthritic knee. If you are considering a knee replacement, you want to go to a hospital that does a high volume of this procedure, and higher volume surgeons and higher volume hospitals have much better outcomes when it comes to joint replacement surgery. At Emory University Orthopaedics and Spine Hospital, we do several thousand total and partial knee replacement surgeries each year, routinely employing the latest surgical techniques and technology, including computer assistance and robotics. A typical knee replacement at our hospital takes roughly 1 to 1.5 hours, and almost all patients go home on the day of surgery. The infection rate at our hospital has consistently ranked among the lowest in the country. We are located close to, but an entirely separate campus from, the other hospitals at Emory University, and we have staff who have dedicated their entire careers to care for orthopedic patients. This is key, as your care team, from the surgical staff to the anesthesiologists, nurses, and therapists, will be completely focused on your knee replacement surgery and recovery. We welcome you to consider Emory for your routine care, but also to contact us if you need expert advice on surgical options and to better understand the potential benefits and risks of surgery for you. We welcome the honor and privilege of your trust and look forward to meeting you, understanding your goals, and providing you with an individualized plan to care for your needs.